Good afternoon, everyone. Thank you for taking time off your lunch and learning a webinar, an interesting thing today, respiratory physio and when to refer to clients. One of the most boring topics, and I've been given that task to make it super easy for you guys. So yeah, at any point, if you have any questions, type in the question answer bars. Happy to take questions at the end of the topic of this presentation. And also, this session is going to be recorded and be on YouTube. So with that, and with respecting everyone's time, I think we'll start. So today you're going to learn about respiratory physio and when to refer your clients to us. Now I start, firstly, I would like to acknowledge the traditional custodians of the land that we are meeting on today. And I also pay my respect to their elders, past, present, and emerging. I extend the respect to the Aboriginal and Torres Strait Islanders who are joining us today. So again, just some housekeeping. This webinar is being recorded and will be out tomorrow on YouTube. Also, if you have any questions and answers, please hold it till the end or use the chat box. I think the chat box will be disabled, but you can definitely have the question and answer typed in so that you can answer at the end. Now, the idea of today is that you're going to understand what's about respiratory physio, why this is important, what the physio is going to do, and what else do we work with, and how we work with complex cases, and also when to refer. Because one of the things that people go and ask me is, when do we refer someone for physio? We don't really know when the exact right time is. And problem with respiratory physio is that timely care is very important for them. In some cases, it's a matter of life and death, because if you can't breathe, you can't survive. We will go through the next one. Who we are, Empower Healthcare. We've been established in 2016. And one of the things that we really work hard is we strive to deliver exceptional care that potentially impacts people in a positive way. Our vision is to be the first choice for healthcare practitioners, and we do provide a lot of different services in a lot of different states. I'll go through that in a bit, but these are just some of the offerings that we have in different states. It might vary among state to state. So we do supply physio services, OT, massage, osteo, dietetics, speech therapy, podiatry, allied health assistant, and also nursing. And I think nursing is very confined to Victoria at the moment, but we're looking at expansion. So we're adding more clinicians and more expertise to our list as we keep growing this organization. The next thing that we have is, who am I? Funny thing, it's one of the things I least sell to people. My name is Yusuf Syed, and I'm a dad, a husband, a physio, and a community worker. Do a lot of volunteering within the community, be working with a lot of multicultural community to try and do CPR programs with them, get them to do bystander CPR awareness, trying to teach them how to use defibs, trying to cut through the barrier and get people to donate blood is another thing. And I also volunteer in the local food bank. So we pack things and non-perishable stuff. And yeah, we do it as a team with my two little daughters there. One's 12 and one's 4. The four-year-old is the cheekiest one, as you know, and she is my second job. So again, to give you an idea of what I do, I've been a physio for 2+ decades. I call myself a generalist, and the reason why I'm sharing this with you is because you do not need a specialist cardiothoracic physio to actually do a proper chest physiotherapy. My special interest is in sports and musculoskeletal. My special interest also involves working in private practice. In my past, I worked in ICUs, I worked in hospitals, and we've taken that knowledge from there into residential aged care and also home care, including NDIS. So you can see that every physio will do a great job. Part of our training in uni is heavily focused on hospital work, and part of our extension of that hospital work is trying to do as much as we can within the homes of people. So we're coming here to our lungs. So some interesting facts about lungs. I've had some people ask me how large are your lungs, and to be honest, if you spread out your lungs, or not your lungs, but if you spread out, say, a lung, that would cover the size of a tennis court, because they're so elastic. So it's very interesting. Now, if you see the diagram there, you've probably seen this a million times. On the right-hand side of the screen, we have the right lobes, and then we have on the left hand of the screen, we have the left lobes. Now, the right side has 3 lobes, and the left side has 2 lobes. So very interestingly, the left side makes way for the heart, and that's why you have one less of a lobe. Interestingly enough, this is the workhorse of the body, and if we do not have the oxygen coming in and pushed into our bloodstream, we probably will not be able to think, to talk, to survive, to move. So it's very important that this lung works as efficiently as possible. So the air that comes through, if you think about a branch and you think about trunk, think about this as an upside down tree. And the trunk is what we call the trachea, which is the main thick windpipe that we see. And then it branches down into branches and little leaves. So the branches are called the bronchus, and then it goes to the leaves, which is the bronchi. And there's even more tinier bronchioli. And finally, it goes down to even smaller things called alveoli. And that's where the magic of the gas exchange happens. So the gas is taken from the air, and it is immersed into the blood. So it's a very interesting kind of a process that happens 24/7 behind the back door. It sometimes amazes me how that machine keeps going on without any input of voluntary inputs. So interesting. From the moment we're born, most of the time, without us noticing, our lungs are working away. And, if someone is lucky to live, say, 80 years, that would have been almost 700 million breaths in their lifetime, in their lives. And that is a lot of breathing, to be honest. Another interesting fact is we breathe on an average 6 liters of air every minute, and it's how we go about with things. 1 in 3 Australians will be impacted by a serious lung condition in their lifetime, and pretty much everyone at some point of their life would have some kind of respiratory issue. So it is a very serious part of the body, and without it, the oxygen doesn't reach the heart, and the heart can't pump that blood everywhere. So yeah, lungs are important. So I move on to the next slide. What are the signs of sick lungs? To be honest, what we want from a lung is for it to take the air in, make that exchange at that smaller levels, and for it to push that air or oxygen into the bloodstream. Now, when these pathways are clogged with sputum or anything that is thick. It could be sputum, it could be blood. That's when someone tries to clear that pathway. And that to us looks like a cough because you're trying to push it out of the system. So you're trying to go and you try to spit it out. Now, when you do that, and when there is an improper exchange of gases, you also will have shortness of breath. So you'll be like working harder to breathe. So you go, you're working a lot more harder and you're short of breath doing certain exercises because your body demands more oxygen as you move. So again, the demand reduces or the demand increases because of the clogging of the lungs. So there's shortness of breath, there's difficulty breathing, and also to push things out of that trachea, the body in itself does this little protection mechanism where it increases the mucus production, that it allows those foreign bodies to be pushed out easily through the semi-liquid that comes out of the body. So it's a very interesting mechanism that works there. That's a sign of a sick lung if you have increased mucus production. The other thing is if people are associating pain or tightness in the chest when breathing, this could be also a sign of sick lungs. Again, this is where it also overlaps with probably a heart attack or some other conditions happening together. But you can imagine if you've been coughing a lot, you're going to have some pain and tightness in your chest. Now, how can people help? How can physio help people who have chest and lung problems? So the way we go through things is pretty simple. As a physio, we have to first assess what's going on there. We try to hear for the lung sounds. We put a stethoscope to the chest. We listen to the sounds. We look for air entry going through each lobe. We look at how quickly are they breathing, so the respiratory rate. So we're going, is that more than what it should be? Is that less than what it should be? We look at the quality of the breathing. Is it just upper chest breathing, or is it lower chest breathing? Are they able to, or are they struggling and they're going and pulling the accessory muscles of the neck and working super hard? So that quality is also important. We also look at the oxygenation, and that's where the fingers, the pulse oximetry and stuff we put on the finger and check how much of that is being saturated in the blood. We also look at the different way the chest is configured, because if you have a collapse in certain places, that helps us in looking at things and looking at the general health of the person. That's what we assess. So to happen, then what we do is after the assessment, we then go into the management. Now, in the management, we look at both acute and chronic conditions. What we also provide is hands-on chest physio when needed, and we'll talk about that in the next few slides. Also, part of our work is to try and get them back to functioning normally. So we aid in increasing that functioning. So how do we improve that endurance, oxygenation, and quality of life is through some exercises. That exercises will be in the form of breathing exercises, specific breathing exercises. It could also be in the form of some postural drainage. It could also be in the form of doing lower limb and upper limb exercises, because that increases the demand on the lungs to push enough air or oxygen into the blood. Also, another thing that we have to do is we definitely look at quality of life, but lifestyle adjustment, because again, these are people who are working super hard on breathing, that they need some strategies to assist with their managing of fatigue and managing of when to also and how to breathe. Again, because they are in that mode of going, using the accessory muscles, it is very important that we need to get back the rhythm again. So developing strategies, everyone is a bit different. There's no two people that I've seen in my 20 plus years of experience that have had the same kind of treatment. Everyone needs some change in the way we approach them. In some cases, we might have to work with OTs. We have to work with a dietetic. Again, the idea is that if you don't have enough fuel in the body, you're going to burn up really quickly. With OTs, we're looking at probably assistive devices, oxygens, seeing how things are, and majorly then looking at trying to bring the balance and conditioning and working through there. Another part of our where we do things is education. Now, this is not just educating the client, but it's also educating the carers that come there. So currently, I'm seeing an NDIS case of a young adult who had cystic fibrosis as a kid, and we are working through not only teaching the carers how to do it, but also the family members, so that they can get involved in the care. They can do something about it when they see it, and they're not reliant solely on the physio to come and help at that time. And also about talking about lifestyle modifications to improve their quality of life. Okay, so I told you talk a little bit about chest physio. Very interestingly, chest physio is considered to be like a thing that's been continuing for many years, and it's very in a nutshell, the aim is to restore the normal gas exchange in the lungs. That's the whole aim of it. Now, to restore that, what we need to do is we need to remove secretions and improve the airway clearance so that we can make the breathing and functioning easier. So what we'd like to do is to try and get that cough that mucus out, and open up that air so that it's not clogged. And along with that, what we're looking at is to make sure that all the lobes are working and not just being clogged with mucus. One of the things is it's so important to do that is because if you let that mucus sit there for too long, it can lead to that lobe being collapsing. That mucus can go stationary and it can go thickened, and it just means that that lung will no longer function the way it should. So losing one lung or one part of the lung, you can still survive. But the thing is, the work that is being done by the other lobes will be extraordinary. So it means that, again, it puts a lot of work and effort on the person to breathe more heavily. So again, this is the idea: to decrease the work of breathing, to prevent any lung collapse, and basically to improve the quality of life like they would like to do within their own homes. To give you an idea of some of the physio treatments, I'm going to throw a few words here. Or I might have already said a few things, but the idea is to give you an idea of what we do. Might not be applicable in all cases, but definitely something that we do. There's no better way, to be honest, to clear an airway through a good old-fashioned cough and spit. But we can help the cough to be effective or assist when a cough is too weak. And these are the different ways we can assist that. We call ACBT, is active cycle breathing technique, is we use breathing combined with positioning to try and get air behind those mucus to get it out. There's another thing called positioning. We do postural drainage, and we try to use gravity to try and get the liquid out of the body, so the mucus out of the body. Additionally, we can use things like PEP, commonly seen bubble PEPs, flutters, a cappella, different style of things. They're normally prescribed to the patient by the GPs or by hospital physios, which would have provided that to them for their further management. Again, we also use manual techniques such as vibrations, percussions, and these are done in a way that is that is comfortable for the client, as well as it is effective in what it does. In some cases, we also have to use suctioning, and that's when they can only bring it to their trachea, and then we have to then try and get the best out of there. So that's again in cases where people have poor lung clearance or do not have the energy to take it out. When to refer to the physio, there'll be two general pathways of when to refer to the physio. And this is important because a little bit of proactiveness in this field kind of really helps get on top of it. Breathing is so important. You probably heard people get pneumonia and they die. People have COVID and they die. So this is very much linked to oxygen in the body. So either one of your clients might have been in the hospital for some respiratory issue. So what we suggest is you need to start the process early on so that we can get all the information out and we're ready to go once they come home. Now, from the hospital, some of them go to a respite, some of them go to a aged care facility where they will have some physios there. But if the main aim is to get back to home, then it's really important to engage us early on in that cycle of rehab. And it's nice to cover all the journey along so that the information is there. So providing that information is so important and so vital to the physio that they can hit the ground running from day one they enter the home. The other pathway that we have is the GP referral. So it might be an acute case or a chronic case, and the GP says, hey, I need you to see a physio. So again, the GP would, as soon as we get that information, the more the better. Chest x-rays, all the relevant blood tests, even a doctor's summary. All of this is so important for us as physios to try and work out what exactly is going on, what has been done so far, how aggressive can we go with our physio, how fragile is their state, and do we need to involve someone else in this care while the GP has referred this only for physio? Because sometimes we have to include a dietitian into it. Sometimes we have to include the OT into it to try and source out oxygen and try to change the way the whole setup is. So it's very important for us. The more information you provide, the better in the referral. From your angle, from a case manager's angle, it's nice to see a few things that you can see and you can kind of go, this is ringing alarm bells. One is if someone you're talking to and they're coughing on the phone, they go and they're not able to get it out. Or someone is coughing and it's a really moist cough, and you can actually feel it over the phone. You don't have to be in presence of them. The other thing is difficulty breathing. They're going or shortness of breath, fatigue, where they say, you know what, I have to lie down. Sorry, I can't talk for too long. I have to lie down. Or they'll say, I've just been lying in bed the whole day. Or functional decline. I haven't taken the bins out. I haven't been to the garden. I haven't even cooked anything. So again, those are the things that you can observe from your end that can easily help us to go, hey, this person needs a respiratory physio. Keeping in mind that you can also see, this is the straightforward respiratory cases, but you can also have associated conditions like someone's having Parkinson's, a neurology problem, or MS or GBS, Guillain-Barré syndrome. And associated with that, because their body is working super hard, they will have some respiratory conditions that they're prone to. So again, this is where we come in. Cardiac post-surgery, it's very hard for some of them who have open heart surgeries to actually cough because the chest is so tight. This is where a physio can help and work with trying to get some of that secretions out. We know our elderly are more susceptible to respiratory issues, and anything like surgery, general surgery or cardiac surgery or orthopedic surgery, they just make it a little harder. Some of them, general surgery and orthopedic surgery, they're under anesthesia. So anesthesia in itself kind of has a certain risk. So again, we do find that people do retain secretions after surgery. Post falls is another thing. when we see a lot of post falls, either they've fallen down with an outstretched hand, they've broken a collarbone, they've hurt a few ribs. It's really hard for them to breathe, and compile that with any cold or pneumonia, and then they go really downhill pretty quickly. So on top of dealing with pain, they're also dealing with I can't breathe. So it becomes a slippery slope, and we want to get on top of that as quickly. So just keep in mind that that's where it is. Post-cancer recovery, again, this is also another phase that we work with, and palliative care. Again, to keep them comfortable, get them going, get them breathing as comfortable as possible, helping them with the oxygenation. That's where we will help with them. There's a bit about physiotherapy and COVID, keeping in mind that in the last few years, there's been the long COVID symptoms that we've seen. It's really tough with elderly, and it requires a multidisciplinary approach where we have to look at the lungs, we have to look at their lifestyle modification, we have to look at their exercises. And these are people who have to manage through their fatigue, and we have to work hard with them. And it's a long work. But I'll tell you what, it is rewarding because the quality of life improves remarkably. And it doesn't matter whether you're 16 or 80, once you start working on your lungs, it definitely helps. Just to clarify a bit of the referral pathway for chest physio, this is to particular chest. If someone has a cough and it's a dry cough, that's okay. The GPs can look after that, or it can go away. But when you have a wet cough, the major thing to see is that can the person clear it easily? Can they spit it out? If they are unable to clear and spit it out, then you definitely need a physio. But if they can clear it, but it takes them a lot of goes, that means the sputum or the cough is not as effective as it should. So that's where the physio is needed. So hopefully we'll have this on your screen to ask a few more questions afterwards. That's the evidence, and that's pretty much the end of today's presentation. How do you reach us? That's one of the common questions people ask is, if you go online to our website, we do have a client referral form that you can put all those details, as I explained, that it's so vital for us to know. As a clinician, we don't want to be chasing down that information because it takes away from important time with the client. You can also request a wait list card, and you can also request a rate card depending on which state you are. Any questions? If you have any questions, you can raise your hand. I don't think I did an amazing job explaining this.
I think that was great, Yusuf. That was really good. I liked the part where you said even talking to people on the phone and what they can hear. You know, it's it's a good heads up for people talking to their clients on the phone and looking out for those warning signs. Yeah. I think you were so thorough that there are no questions. You can go on with the next slides because I know you have clients. So if anyone has questions, they can type it in the Q&A or raise their hand and I can allow them to talk. So, yeah.
That's good. The next one is just to let you know that, you know, our service coverage area, we do service the 4 states, as you see, Victoria, New South Wales, Brisbane, and WA. Mostly Perth. Now, the thing is, do keep in mind that if you have any questions about, you know, where your client's located and things, please call our office and we're quite happy to help out. There's different services in different states, so that will, as you can see, the team will help you, guide you things. So definitely give us a call or send us a referral, and we will be able to help you even further with your queries. Now, these are quarterly lunch and learn webinars. So we have a few lined up for you guys. So the next one will be on the 4th of June. We have a swallowing success webinar. And on the Friday, 8th of August, we're looking at doing a compassion in care, mostly around palliative care, enhancing end-of-life quality. And then we're looking into podiatry ones, and we'll announce that in October. Considering everything, you know, we're also introducing some weekly webinars. These are going to be some wellness webinars, and it's basically, you know, to educate people on how we support wellness at home. And, you know, we've got some topics lined up from OTs, from speechies, from dietitians, and even physios. So what we say is there's a lot happening, and to be in it, you got to register via the events page. So make sure you register it, and we'll send you the updates as you go along. I'm happy for you to scan the QR code, or you can just go to the events page on our website, empowerhealthcare.com.au. That pretty much is the end of today's presentation.
We have one question, Yusuf. Can you see the question, or do you want me to read it out?
Yeah, if you can read it out, please.
It's from Liam. We currently have a client with lung cancer and on 24/7 oxygen at home.
Yeah.
NP2L. Do you think the client benefits from chest physio?
Yeah. See, definitely a person like that, it's worth assessing it. And once we assess him, we'll work out whether what do we need to go from there. It takes in consideration what the client wants too. Now, when they are at end of life, sometimes all they want is to be comfortable. So it depends on the client with their shared goals and values, that what we need to do for them. Ideally, we don't want to see them in further distress. But it's kind of a balance between trying to get them comfortable and also not pushing that boundary too much that we are giving aggressive chest physio. But I would say, yes, let's start with an assessment, and the physio will come back to you and say what's going on there.
Lovely, thank you. Good question, Liam.